Yemeni citizens struggle to meet simple needs such as access to clean water, sanitation, food, and primary health care. Leukemia patients are among those who are most affected by the healthcare shortage. The following report has more details.
In Yemen, millions of people are going through the worst humanitarian crisis in modern history. While we live in a time when infrastructure and basic services have become an integral part of daily life, the Yemeni citizen struggles to meet his simple basic needs, such as access to clean water, sanitation, food, and primary health care. These crises double the suffering of leukemia patients in Yemen in light of the collapse of health situation and spread of diseases and epidemics. Nearly 8 years of war have pushed the fragile health system to the brink of collapse. It's more difficult than ever for people with chronic diseases to get treatment. During the war, nearly half of Yemen's hospitals and health facilities were damaged, bringing the health system to devastation, as the current situation resulted in 35,000 cancer patients, and approximately 10,000 new cases are diagnosed each year, with the hope of surviving, not thriving.
This disease is very dangerous and we cannot afford the medicines. We need to be provided with tests and treatment finances. Government organizations who should provide us with blood bags do not do so. Employees exploit this by selling blood bags illegally.
Patients with deadly diseases were the most affected by the civil war, noting that many cancer patients skyrocketing medical bills or have no access to medical treatment centers. The treatment center in Sana'a is the only specialized hospital for children inflicted with blood diseases, and now it's in dire need of medicines and other supplies, as the blockade cut the support from humanitarian organizations outside the country.
These diseases need tests and treatments, and families can't afford them, especially the CRP test, as it costs 45,000 rial, and a virus treatment dose costs more than 50,000 rial. Virus C is considered the main problem, especially for children with leukemia, so we call on concerned authorities to provide these patients with medicine and treatment costs.
Suffering of patients in Yemen is doubled or even tripled due to the chronic diseases distress, and patients even face harsh conditions and a constant struggle to obtain medical care amid the ongoing war.